populations, can it be
May I request Dr. Naveen Dang to chair the plenary lecture by Professor Masanobu Nanno. Dr. Dang is the director of Dr. Dang's Lab Private Limited, New Delhi in India. He is a recipient of several awards and honored with the Vishish Chikitsa Ratan Award on the occasion of Doctors' Day on the 1st of July 2014 for his outstanding contribution in the field of medicine and service of mankind, and the prestigious Dr. B.C. Roy National Award by the President of India in the year 2009. He is a member of several organizations. His lab is the first diagnostic lab in India to get the ISO 9000 certification in 1995, 2 decades ago, and also the NABL accreditation in all departments of the lab. His lab featured in the Limca Book of Records for being the first lab in the country to post patients' reports using web-based technology. Dr. Dang, I request you to introduce Professor Masanobu Nanno.
Sharad, thank you very much for your kind words. I'm immensely privileged and honored to be out here, and that too, to introduce my dear friend, Professor Masanobu Nanno. Can I have Dr. Masanobu Nanno out here, please?
On top.
Dr. Nanno. Dr. Nanno is not only a friend, but a pioneer in his field of probiotics. He is the executive officer and deputy director of the Yakult Institute in Tokyo. He has done immense work on different aspects of probiotics as they relate to the health of the gut flora. He has a large number of publications, to be exact about 76 publications, and nearly about 18 chapters in different books. What an honor it is for me to have Dr. Nanno out here. But I must add before I proceed from here that why me? Why me to chair this session? Because I remember in 2007, when the foundation held its first symposium, incidentally the 7th symposium which is happening, I was a great skeptic. I thought that no, probiotics, they're very limited value or practically no value at all. Rather, I went to the extent of describing it as a 10 rupee nonsense. But now, and believe it, I'm not saying it for the sake of saying it, a probiotic every day is a routine for me. I cannot do without it. It has become a habit. And I think maybe that's the reason why my gut flora and my health rocks. Maybe that can be one of the causes. So, from a known skeptic, an anti-probiotic man, to a person who's totally converted to talking and expounding the cause of probiotics. Here I am, and I accept it. Dr. Nanno, please.
Thank you very much, Dr. Dan, for your kind of introduction. So, good morning, ladies and gentlemen. And before going my talk, I would like to express my deepest gratitude to Dr. Gangri and also the related persons involved for inviting me to this wonderful conference. And I'm very happy to be here with you. And I'm very happy for having an opportunity to present our current data regarding the benefits of probiotics. So here are the topics which I will talk. First of all, I would say what is probiotics by showing some data about the Lactobacillus casei shirota. Next, I would like to show the beneficial effects of L. casei shirota by focusing on the preventive effect of L. casei shirota against breast cancer. And finally, I would like to propose how L. casei shirota exert the beneficial effects. Namely, L. casei shirota can modulate our physiological functions, including immune functions, nervous functions. So we think that these physiological effects may be mediated by taking probiotics. So I would like to emphasize that gut microbiota is very important in maintaining for our health and disease. But gut microbiota can be easily altered by various factors such as diet, severe stress, aging, antibiotics, or infection. These factors induce the disturbance of gut microbiota. This is dysbiosis. So probiotics are live bacteria, and they can survive in the intestine after ingestion. Therefore, we expect that probiotics can change and recover the normal gut microbiota. And if our gut microbiota is still disturbed, various diseases occurs as shown in the right side. But our gut microbiota is recovered by probiotics. These diseases may disappear, or the risk of diseases may be reduced. So when we see the cancer incidence, what we can see? Here is cancer incidence data in Japan and India. The total number of cancer in Japan, about total number of cancer in Japan, the colorectal cancer is the most serious. But we see the cancer of females, as shown here. So breast cancer is the most serious in both India and Japan. Therefore, I think if we can prevent the risk of breast cancer, the females may be more healthy in both India and Japan. And also, it is known that the lifestyle and cancer incidence might be related. Here is the data of an epidemiological study surveyed in the Japanese immigrants who moved to and resident in foreign countries. When we see the colorectal cancer incidence, the risk of the Japanese living in Japan and the Japanese immigrants in Sao Paulo was similar, but higher, much higher in Hawaii immigrants. In the case of breast cancer, the risk of Japanese living in Japan is lowest, and the Sao Paulo immigrants, the risk is a little bit higher, and the highest in the Hawaii immigrants. These data suggest the cancer incidence might be affected by the change of lifestyle. This data suggests that lifestyle in Hawaii is critical for the increase of this type of cancer. Therefore, we think that if we can do the control the lifestyle, maybe the cancer risk can be reduced by some variable tools. And also, to understand why the change of lifestyle may affect the cancer incidence, the relationship between gut microbiota and cancer incidence has attracted attention. This is data comparing gut microbiota between colorectal cancer patients and healthy controls. So as you can see here, these are big differences of mucosa-associated bacteria and gut-human bacteria between colorectal cancer patients and healthy controls. So, therefore, we imagine that the change of gut microbiota may influence the risk of cancer. If this is the case, probiotics, if this is the case, we expect that probiotics may change and recover the normal gut microbiota and then reduce the risk of cancer. So from here, I would like to show data about Lactobacillus casei shirota, showing that they are probiotics. Here is effect of probiotics in the elderly. So to see the effect of probiotics in the microbiota in the gut, in the elderly, we did this experiment. As shown here, elderly with the age of 82 plus minus 10 years staying in the hospital in Japan were given Lactobacillus casei shirota containing yogurt for 6 months. And then at the intervals, microbiota, organic acid concentration, and pH in feces were examined. As shown here, in the bifidobacterium lactobacillus in the feces gradually increased during the ingestion, and also administered Lactobacillus casei shirota can be recovered alive in the feces. In contrast, the number of Clostridium perfringens, Staphylococcus, and Pseudomonas gradually decreases. This data shows that the Lactobacillus casei shirota can give impact on the gut microbiota in the elderly. And also, acetic acid level is increasing, and also pH in the feces is decreasing by ingestion of Lactobacillus casei shirota. So these data taken together show that Lactobacillus casei shirota can survive in the gut lumen and is recovered alive from the feces and normalize the altered gut microbiota, and also improve the bowel movement, although I did not show the data today. And also, Lactobacillus casei shirota is known to decrease the production of noxious substances such as paracuresol or mutagens produced by gut bacteria in the gut lumen and allows their clearance. These data guarantees that Lactobacillus casei shirota is probiotics. So here are the areas for which probiotics can be applied. It is easily understood that probiotics may be effective for prevention of gut-associated diseases such as constipation, infection, IBS, and IBD. And also, probiotics can modulate immune functions, so we expect that allergy and autoimmune diseases may be improved by probiotics. And as a new area of probiotics, urinary organ-associated diseases, cardiovascular diseases, and stress-induced abnormalities are new target of probiotics. Today, I would like to show the effect of probiotics using Lactobacillus casei shirota against the cancer development in human trials, human trials, and animal experiments. Here is a protocol of an epidemiological study to see the effect of dietary and lifestyle habit on the incidence of breast cancer. The subjects are Japanese women with 40 to 55 years old. Among them, 306 were breast cancer patients, and 662 were controlled. So this is a case control study. So they were asked about the lifestyle, such as diet and exercise habits. And here, cancer patients were defined as women who have undergone operation within 1 year prior to the study. And the controls were the women who had without past or present breast cancer. They were asked, and the questionnaire answers about diet and exercise habits were analyzed to compare and know the effect of dietary habit on the cancer incidence. So especially this study focused on the effect of lactic acid bacteria and soy-derived products such as tofu and miso soup in Japan on the incidence of breast cancer. So question is the consumption LAB and so isoflavone effective for the prevention of breast cancer? So the association of the soy consumption and the breast cancer incidence has been confirmed in a number of epidemiological studies. In this study, we confirmed that when we compared the risk of breast cancer in the women who consumed soy isoflavones by less than 18.76 milligrams per day, the risk of the women who had consumed more than 43.75 milligrams per day was 0.48. So with our study, this study reconfirms that women who consumed more soy isoflavones have a lower risk of breast cancer. So a new finding of the study is the following. If we compare the risk of breast cancer between the women who consumed more dairy products than less dairy product consuming women, the data is here. So when the ratio or relative the risk of breast cancer in the women who consumed less than 4 times a week lactic acid bacteria containing drinks was set as 1.0, the relative risk of breast cancer in the women who consumed more often LAB containing drink was 0.65. So this result shows women who consumed more lactic acid bacteria containing drinks have a lower risk of breast cancer. And also, what happens when women consume both LAB drinks and isoflavones? The result is here. In the population who consumed lower isoflavones and lower LAB drink consumption is highest risk, and their relative risk was set as 1.0. You can see that so isoflavone alone or LAB drink alone can prevent the risk, can prevent the occurrence of breast cancer. And also, when the women consumed both higher level of isoflavones and higher frequency of LAB drink, the risk was 0.36, and this is the least incidence of breast cancer. So this result demonstrates that women who consumed both LAB drinks and soy isoflavones have the lowest risk of breast cancer. So this is a summary of case control study. Breast cancer risk is lower in subjects who consumed LAB drinks by more than 4 times per week compared with those who consumed LAB drinks by less than 4 times per week. The greater is the amount of soy isoflavones consumed, the lower becomes the risk of breast cancer. And the lowest risk is observed in subjects who consumed both LAB drinks and soy isoflavones. This data suggests the importance of the diet for prevention of breast cancer. But epidemiological study suggests a relationship between 2 factors, but it does not mean the cause-effect relationships. So to see the effect of lactic acid bacteria and the soy isoflavones on the prevention of breast cancer, we did animal experiments. So in these animal experiments, rats were randomized into 4 groups, and we used PHIP as a chemical carcinogen to induce tumors at mammary glands of rats. Rats were given random experiment diet for 17 weeks, and the incidence and diameter of breast cancer were measured at the intervals. We used this kind of experimental diets, as shown in the center of the right side. So group A is basal diet, and the group B is freeze-dried soy beverage containing diet, group C, LCS containing diet, and group D, diet containing both. And we observed rats for 17 weeks after PHIP administration. Here is the cumulative incidence of breast cancer rats. In this experimental settings, control rats suffered from breast cancer by 74% at the 17th week after PHIP treatment. And as shown here, if rats were given soy beverage containing diet, the incidence was significantly lowered at 14 weeks and 17th week. And to see the effect of soy beverage and LCS in more detail, we checked the number of cancer per rat, namely multiplicity. As shown in the left figures, so if the rats were given soy beverage containing diet with or without LCS, multiplicity was significantly suppressed. In contrast, if you see the cancer size, we checked the cancer size by checking diameter of cancer bulk. As shown in the right figure, so LCS containing diet with or without soy beverage suppress the further expansion of cancer cells after the appearance of cancer. And soy beverage alone did not suppress the growth of cancer tissues. Okay, and finally, we checked the combinatorial effect of soy beverage and LCS. So isoflavone can bind the estrogen receptor on cancer cells competitively, so followed by their death. And estrogen receptor is considered a marker, one of the markers to show the malignancy of breast cancer cells. Therefore, we analyze the estrogen receptor expression on cancer cells. When rats were given soy beverage containing diet, the distribution of estrogen receptor expressing cells pattern is not different as the control rats. But if the rats were given soy beverage plus LCS, the estrogen receptor expression pattern is shifted towards the lower expression of cells, suggesting the breast cancer appearing in the soy beverage plus LCS group were less malignancy. Okay, so this is a summary of animal experiment. So daily intake of soy beverage and LCS prevented the breast cancer development induced by PHIP. It appears that soy beverage inhibits the appearance of cancer cells, namely incidence or multiplicity, but LCS suppresses the enlargement of cancers after the appearance of cancer cells. And also, soy beverage and LCS may synergistically prevent the expansion of malignant cancer cells. This is our conclusion. So, how LCS can prevent the cancer development? To get the answer to this question, we did some animal experiments. So here is an animal experiment to see the effect of LCS on immune system. When mice were injected 3-methylchlorosilane, they suffer from solid cancer with aging, and in these conditions, so more than 40% of mice suffered from the cancer on the 10th week after the injection of 3-methylchlorosilane. But if you give LCS-containing diet to mice, the incidence became lower. In contrast, if you give LCS-containing diet after 3-methylchlorosilane injection in beige mice, beige mice are deficient in natural killer cell activity. In this particular mice, we cannot see the effect, preventive effect of L-carcinosin, LCS. So this suggests that the LCS may modulate immune functions of mice to get attack against the cancer cells. To confirm this idea, we checked NK activity in wild-type mice and mutant beige mice. As shown here, in the case of wild-type C57 black 6 mice, 3-methylchloroquine-induced reduction of NK cells was recovered by LC ingestion. However, we cannot see this effect in the case of beige mice. So this is another mouse cancer model. Here is shown colitis-associated cancer in mice. When we give mice the dextran sodium sulfate containing water repeatedly, the inflammation occurs in the colon and followed by sequentially colon cancer. But in this condition, if you give LCS to mice, the cancer incidence is reduced and also multiplicity is suppressed. This shows LCS can prevent the colon cancer model. So in this colitis-associated cancer model, what is important? The important is IL-6, soluble IL-6 receptor trans-signaling pathway. And we checked the IL-6 production from the, by using the chronic cells isolated from colitis-induced mice. We found that IL-6 production was more excessively enhanced. And also, in the inflamed colon, dendritic cells can produce soluble IL-6 receptor, and IL-6 and the soluble IL-6 receptor can make the molecular complex, then gives a signal through GP130 on the surface of intestinal epithelial cells. This results in the malignant transformation of intestinal epithelial cells. And therefore, if you give soluble GP130 Fc molecule to mice to inhibit the binding of IL-6, soluble IL-6 receptor alpha complex, so preventive effect was shown in the right figure. So therefore, we thought that if probiotics can reduce the excessive IL-6 production observed in the inflamed colon, it may be effective against cancer cell development. So here is the data showing the effect of 4 different lactobacillus strains on the excessive IL-6 production by laminar propyria mononuclear cells of colitis suffering mice. As shown here, among 4 different lactobacillus strains, only LCS can inhibit the excessive IL-6 production, and other 3 lactobacillus strains did not affect or rather enhanced excessive IL-6 production in the colon. So finally, we tried to see the IL-6 production control and cancer prevention is related in the LCS ingested mice. We checked this experiment. As shown here, LCS injection to the mice, the tumor number was significantly reduced. This is a preventive effect. And at the same time, you can see the IL-6 messenger RNA expression is reduced in the colon as shown in the center figures. It is very interestingly, if you give LCS mutant strain deficient in polysaccharide or peptide glycan structure characteristic of LCS, this strain does not have a preventive effect, and also this does not suppress IL-6 messenger RNA expression. These data taken together suggest and reveal that IL-6 production control is very important in the preventive effect of LCS. So here is a possible roles of LCS for gut homeostasis in health and disease. In the physiological or healthy conditions, administered LCS can can be catched by M cells on the pyruvate patch, and dendritic cells or macrophages just beneath the follicle-associated envelope can get the signal from LCS, then give the signal to induce IL-12 production. And as you know, IL-12 is a good and important cytokine to enhance natural killer cell activity. Therefore, a systemic natural killer cell activity might be enhanced in the cancer animals. In contrast, under inflammatory conditions, IL-6 production is excessively enhanced in the inflamed colonic mucosa, and to these animals, when we give LCS to these animals, so LCS might be incorporated with intercellular spaces in the disrupted gut barrier, and then LCS can modulate to IL-6 production towards less production of IL-6. Then inflammatory response is improved. So this complex but sophisticated immune network is a key system for LCS to control gut condition and to maintain homeostasis. So using the short time left, I would like to touch the new aspect of probiotics. As you know, so gut microbiota is related with various lifestyle-related diseases such as type 2 diabetes. And type 2 diabetes are considered induced by the chronic inflammation triggered by gut microbiota. So we examine the effect of LCS on glucose response in diet-induced obesity mice. So as shown here, if you give LCS to the diet-induced obesity mice, so glucose response after glucose loading was reduced in LCS-containing mice compared with control mice. And also, so increase of plasma glucose level after glucose was improved. And also, we checked the effect of LCS on sympathetic nerve activities to know the nervous systems may be involved in the activity, in the benefits of LCS. So as shown here, if we check electrically the excitation of autonomous nerve of liver or adrenal sympathetic nerve, so LCS can reduce the excessive excitation of sympathetic nerve activities, but placebo did not. And I did not show, but we know that the LCS can also reduce the sympathetic nerve activity of white adipose tissue. And in the diet-induced obesity mice, we know that the LPS binding protein level is increasing. Therefore, this means endotoxemia is occurring in obesity mice. So LCS, as I shown previous slide, LCS can reduce or control the IL-6 production. And IL-6 is one of the inflammatory adipokines produced by adipose tissues. So if LCS may control the IL-6 production, and also IL-6 is known to block insulin action, so LCS can improve inflammatory responses and to recover the normal insulin action. And also, I have shown LCS controls the sympathetic nerve excitation. And this nerve functions may regulate adipose tissue function. Then this system also works for control the inflammatory adipokine response. Taken together, these actions against infection or allergy and autoimmunity using animal models and in some cases in clinical trials. And finally, I have touched very briefly LCS may be effective in the metabolic disorder and also stress-induced abnormalities. This is a future area which we have to continue or which we have to survey more and more. So let me finish my talk by expressing my acknowledgement to all the contributors shown here. So some data were done in Yakult Central Institute, but other studies were done in collaboration with researchers in the several universities as shown here. So I would like to show acknowledgement to all of this. And also, if my today's talk will encourage you to drink lactobacillus casei shirota or probiotics, I'm very happy. Thank you very much for your attention.
Thank you, Dr. Nanno. I think it was an extremely interesting presentation, giving us new insights into, at least as far as I'm concerned, very few of us know about the role of Lactobacillus casei shirota. I never expected or knew the wide implications and the wide benefits it's going to provide. It provides, ranging from affecting the gut flora, from autoimmunity to cancers to NK cell activities in the studies which you have shown. If it actually happens, it's going to be a revolution.
Thank you.
Will change the whole aspect, the way we all think, and the way the medical science is proceeding. Thank you, Dr. Nanno. Questions, please. I'm quite sure there'll be a lot of them.
Professor Nanno, excellent presentation. I'm Dr. Shabnam Kaur, from a functional medicine specialist from Mumbai. Prevention of breast cancer is something I teach my patients. So I have, one is a question, another is a comment. My question is, you said in the women who were consuming soy and the lactobacillus, they had prevented breast cancer. How long were your follow-up?
How long follow-up?
Follow-up was for how many years?
I'm not familiar. I don't know the detail of the experiments, but okay. They checked the diet habit and frequency of exercise when the subjects were 10 to 15 years old, and around 20 years old, and 10 to 15 years ago before the study. So maybe from 10 years old to 40 to 50 years old. So 30 or 40 years follow-up.
Okay. And my next thing is a comment, actually, because this is about soy and breast cancer. The data is absolutely divided down the center because the studies done in traditional soy-eating population, that is the Japanese and South Asian population, shows benefits in prevention of breast cancer, but it's not so in the population who do not take soy regularly, like Indians and the Western population. And another area probably where your lactobacillus has an effect is in the estrogen metabolization in the intestine, because we know that estrogen is a carcinogen if it's not in balance. So probably because there have been found some bacteria which help in metabolization of estrogen. So probably that is another area which it helps. Thank you.
Thank you for your comments. And as you say, that soy consumption is dependent on the diet style of different countries. So this data is just done in Japanese. So we have to check the similar study in different countries, persons, and so on. Thank you very much.
You have studied, two kind of treatments, pre and post probiotic and soya isoflavone treatment. And how did you compare which one is more effective, pre or post? And secondly, did you also try to have kind of thing, co-treatment simultaneously together? And what exactly will be the final effect? I hope you have followed the question.
It's a very important question, and when we have to use probiotics before and after and so on. Anyway, our gut microbiota is maybe always changing, every day changing, and I think the gut microbiota that state is very related to the cancer and so on, other diseases. So therefore, continuous consumption is very efficient. But so I cannot say which is better period for continuous drinking is more efficient. I imagine, I think so. And other question is a combination? Yes.
You have covered lots of areas, but there is one more interesting area. I know a couple of issues would be discussed on inflammatory bowel disease and antibiotic-associated diarrhea, but there is another very interesting area is in liver disease. You know, people suffering from liver diseases have a lot of dysbiosis, and if you give them probiotic, there is going to be a lot of changes, and probably even it would prevent liver-induced coma. There is a lot of evidence-based data already published.
Yeah, thank you.
Very excellent presentation and very interesting. You have used soya and you recommend soya beverages you have used in your studies. What about soya products like tofu? If that could be used and encourage those who may not be able to tolerate the beverage, or just as an alternative, what about tofu? Can that have the same effect? And how much of that should be consumed, any soya beverage, or for that matter, any soya product to have that effect? For how long and in what amounts for the general consumer for preventive measures?
I asking the Gato.
I wanted to know the tofu, the soya paneer, or the soya cheese that is an alternative of soya beverage or a product of soya. That can be used as an alternative to the soya beverage.
Sorry, I can't understand what.
It's the soya cheese. You know, soya cheese is available in the form of tofu. Soya nuts or soya tofu, can that be used as an alternative to the beverage? And in what amount should the
I asking how much soy
yes,
food is necessary.
Yeah.
So we are eating in Japan tofu or miso soup is very common diet in Japan, and tofu has one piece of tofu is like this and contains 60 milligram isoflavone. So if you eat one piece of tofu, so the amount is enough. But of course we don't eat every day. But more than 40 or 48 milligram is enough, or more. Sorry, I cannot get your question very well.
It's okay, thank you.
Any more questions, please? Yes. Excuse me.
Nice presentation. So I was wondering if it is the breast cancer is HER2 positive, does it have effect, the isoflavones, does it have effect on HER2 positive cells or triple negative breast cancer cells? So this is marker dependent, estrogen receptor dependent, the cells, cancer cells which are expressing more receptors, the estrogen receptors, for those isoflavone works, or it can also work on PR or HER2 positive?
Okay, so anyway, I understand that estrogen receptor is one of the marker showing the malignancy. Now we have not checked the pathological so more detail, but we think we confirm that cancer tissue in the rats that were fed by both LCS and soy beverage looked less malignant. But yeah, comment is very important, I think. We have to check more carefully.
Yes, Professor Nanno, it's a very nice presentation. This is Dr. Ghosh. Yep. I have some query about the population study. The microbiota, you found that the Japanese, those who were settling in Sao Paulo and also in Hawaii. And what about in Japan? Did you compare all the three populations? Because the oneness of the population in Japan is more lucid one in comparison to Indian population. And other question, second question goes that in disease state and in normal state, when you administer your LCS, then it releases IL-6 and in others IL-10, IL-12. So this goes in redundancy or synergies? Thank you.
Yeah, your first question is very important, and I would like to see what is whether there is any difference between gut microbiota between Japan living population and the Japanese immigrants. And yes, I agree with your idea that it should be checked, the gut microbiota. If their gut microbiota are different, so this we can say more strongly that the gut microbiota is critical. And also, yes, LCS can induce the production of IL-6 in normal cells, but LCS can reduce the excessive production in the inflammatory conditions. Now, I cannot say how, why this difference can occur dependent on the physiological condition or inflammatory conditions. So this is very important issue to be resolved, and we'd like to check again in the future. Thank you very much.
In the interest of time, we have time for about one focus question.
Hello, this is Dr. Jayashree Paul. I am from School of Life Sciences, JNU, New Delhi. It's an excellent presentation. I have one question. The people who are already susceptible to cancer, or they are genetically susceptible to cancer, do you think this treatment would help them?
Anyway, what I showed here, that risk reduction of probiotics, but as you show, as you know by seeing the data, so not all the people, not all the animals can be recovered by the probiotics. So we have to check why some are sensitive and others are resistant. So, so I cannot answer to your question directly, but I think so. Susceptible subjects is also good, I think.
Because I think it will be important to check the genetic susceptibility or genetic makeup of those individuals who are non-responders. Yes. And then we decide if this treatment is going to help.
If we Thank know you. What is the important factor of susceptibility, we can do that. Thank you very much.
I think we'll close the session now by thanking Dr. Nanno for giving us such beautiful insight on the positive role of the work. And let's hope that it has a more positive impact on the health of the world. Thank you, Dr. Nanno. Thank you very much.
Thank you so much.